washing hands, spraying sanitizer on streets, locking down cities. Numerous measures have been put in place to stop the spread of the coronavirus pandemic, from China to Italy and the US.
We will be suspending all travel from Europe.
These measures have been tested over centuries. The Byzantine Empire quarantined neighborhoods. Doctors used to wear masks with long beaks that were believed to protect them from patients with pneumonic plague. Some U.S. cities were even abandoned during the Spanish flu of 1918.
We are doing everything we can to combat this outbreak.
Wir erarbeiten uns also wertvolle Zeit.
지금부터 며칠이 매우 중요한 고비입니다.
Until a vaccine or a drug to prevent COVID-19 is created, public health experts say the only chance authorities around the world have to stop the pandemic is to experiment with various containment measures.
So those strategies have to work. That's an important thing for people to understand. The drugs are not going to be there to save us for more than a year.
Across the globe, a multitude of trucks and people in hazmat suits have been spraying disinfectant that's chlorine-based bleach in most cases in subways, schools, and on the streets. Public health experts say spraying helps kill germs that can accumulate on surfaces that sick people breathe on and cough on and can then be brought back home on people's shoes and hands. These germ-killing efforts actually go as far back as ancient Greece. Homer even writes about it in the Odyssey, when Odysseus burns sulfur in the house of a man he's killed in order to purify the place. Raina McIntyre researches how epidemics can threaten public health systems.
You get two types of viruses, basically. One type that have an envelope around them and another type that don't have an envelope. And the ones that don't have an envelope are really hard to disinfect.
Luckily, coronaviruses are the type with an envelope, like the influenza virus or hepatitis B, which means that soap and disinfectant can destroy that envelope and kill the virus. Public health experts say blanketing large swaths of a city with sanitizer isn't particularly effective. It takes manpower, money, and time. Instead, more targeted disinfection in places like hospitals or nursing homes is more effective at curbing the spread of the virus. Thermometer guns are at the front line of the coronavirus pandemic, from schools to workplaces, gyms, and airports. The aim is to identify people with fever, one of the symptoms of COVID-19, and to stop them from entering public spaces.
Because they are such common symptoms, you will identify a lot of false positives.
Agarista Baca has studied public health policies following the West Nile virus and the H1N1 outbreak. Baca says in some cases, thermometers can give you inaccurate measurements, like when putting it a few inches away from someone's head. Making testing even more complicated, some people infected with the coronavirus may not get a fever or may not have developed symptoms yet.
We know, for example, from the data from China, that about 80% have mild disease. They might have really low-grade fever or no fever at all. And they have other symptoms like they don't feel good, they have muscle aches and all that, but they might still be transmitting.
To Baca, thermometer guns can be more of a political tool.
You increase the feeling of security in your own country because you're taking measures.
The gold standard among public health experts is to isolate a person who's tested positive, then identify everyone that person's been in contact with. It's a process called contact tracing. One of its most famous applications happened when governments used it to eradicate smallpox in the 1950s and 60s. In theory, the earlier you start quarantines and contact tracing, the better the results, but it's extremely labor-intensive.
What's of greater concern with the measures is how well they're implemented. If they're slow, if they're not thorough, if you don't have enough people to do them.
Dale Fisher was on the World Health Organization's team that visited China in mid-February to assess the country's response. He said the epidemic in Wuhan was too widespread to do any quarantine or contact tracing.
What we saw was an extreme, which is when there is so much transmission happening that you really can't effectively do the contact tracing because there are just physically too many people to chase up.
So authorities went for a full lockdown. They applied a sanitary cordon, shutting down all activities in the region and therefore locking together sick and healthy people. Officials in China said their measures prevented a catastrophe at home and bought time for the rest of the world to prepare defenses against the new coronavirus. Italy, France, Spain, and Greece ordered their own nationwide lockdowns. In France, for example, people can only leave their houses in certain instances, like to shop for groceries or medicine, or when working at home is impossible. But some experts say the lockdown of an entire city or region is usually the result of mismanagement during the early stages of an epidemic.
It is a very draconian, very disruptive, very painful measure. It has huge downsides because, of course, if people can't go out, there are a lot of other vital things that they can't do.
Jeremy Kanindijk led the U.S. humanitarian response in Africa during the Ebola crisis. He says a lockdown often means some workers won't be able to earn money.
Financially, it's a very nerve-wracking.
It can also prevent doctors and nurses who have children from being at hospitals when they're most needed because of issues with finding childcare.
If you're a day laborer or you need to run your shop every day in order to eat, well, if you have to choose between starving soon or maybe getting a disease, you're going to choose to maybe get the disease and go to work.
Without support measures, Kanindijk says strict sanitary cordons don't work. That's what happened in some cases in West Africa in 2014.
There were attempts early on during the Ebola outbreak in Liberia to lock down neighborhoods, in a very famous attempt to lock down a poor neighborhood called West Point in Monrovia in Liberia, and it was an absolute disaster. People rioted, they rejected the quarantine, the forced quarantine.
Most public health experts advocate isolating specific groups of people and to use social distancing to minimize contact between people.
These measures, and especially social distancing, are how we can ease the burden.
We're asking everyone to work at home if possible, postpone unnecessary travel.
As of tomorrow, our public schools will be closed.
Many countries have now asked people to respect such measures, which include closing schools, asking people to work from home, and canceling large public events. St. Louis did this during the Spanish flu pandemic in 1918, whereas Philadelphia allowed large public gatherings, notably a citywide parade. The number of people infected peaked in Philadelphia and overflowed hospitals, while the spread of the flu slowed in St. Louis, which gave more time to doctors and nurses to cure patients. Philadelphia suffered twice the death rate of St. Louis. Both the Spanish flu and the coronavirus were previously unknown viral strains for which there was no existing vaccine. So until a proven medical treatment for COVID-19 is developed, cities and countries will be using the measures developed over centuries to try to prevent further fatalities.